welcome to another week of what we find to be an incredibly exciting, interactive, somewhat entertaining, but 95% informative show that we do from Maiden Lane Medical every week called Women's Health Weekly. And we're looking forward to getting started. Tell me what fertility is.
So the definition of infertility is basically 12 months of trying to conceive without success. That's kind of the basic definition for you. Go ahead.
Is that for everybody? Is that across the board? Like 12 months, no, not able to get pregnant. That's it? You're infertile?
Yeah. So that's the traditional definition of infertility. Of course, the second question, most important question is, well, when should I seek help? And that varies depending on age. So, if you're under 35, most women will try for 12 months or so before seeking help. If you're over 35, if you've been trying for 6 months or more, we would recommend that you see somebody or at least talk to your OBGYN about it. And a question I get very frequently is, well, when's the right time to see a fertility expert? And my answer to that is anytime, just to make sure everything is kind of normally happening. Usually these consults are covered by insurance. And so there's really no risk. I mean, a lot of people have this misconception that just by way of seeing a fertility expert, you're going to be pushed directly into treatment. But I actually see a lot of patients who I just counsel them on, optimizing natural fertility, check to make sure everything's kind of working, and then tell them, go try on your own for another 6 months. If you're not pregnant, you're hooked in, who to come back and see.
I heard an interesting term a while ago, reproductively efficient. So someone is able to get pregnant within 12 months before the age of 35 and within 6 months after the age of 35, they don't have fertility issues.
Under the umbrella of infertility are a lot of different diagnoses. One of those is recurrent pregnancy loss. So it's not just the ability to become pregnant, but it's the ability to, carry a pregnancy to term. I would also include that under the definition.
Dr. Davison, is that something that you see fairly frequently in the office? And
I do. Both speaking to the first question, just to go back for a second, I agree with this, just the comment of when to refer patients. I mean, I think even if the conversation sometimes is just coming up in the office, I think that's even reason enough sometimes to refer patients who have a lot of questions. We do see a specific subset of patients, so this chronic pelvic pain endometriosis population. Many of them, some of them I'll be operating on, others will be undergoing medical management, but we do talk about fertility, and many of those 20-year-olds I actually will refer for a consultation. I'm sure we'll touch on this, but now that we also have egg freezing abilities, it's really relevant to identify these concerns and address them and really listen to them, because even if it's just for a consultation, there's so much valuable information, there's so much reassurance that comes from those visits I think we start these consultations much earlier than we used to when I first started practicing. To speak to the recurrent pregnancy loss conversation, that comes up as well. And even though a lot of the components of the workup, of course, we can do, I think that it's just a much more holistic, thorough approach to refer a lot of those patients out. So really, we utilize this relationship with our infertility specialists so liberally, which is great.
So just if you wouldn't mind, I'm gonna get you on two things here. One, the concept of timed intercourse, timed conception, and two, what are the basics that a woman should expect their doctor to do?
I'll talk about timed intercourse first. So let's take, everyone's individual, but in a textbook, when I say cycle, I mean period to period. So if you looked in a textbook cycle from period to period is about 28 days. So I always tell patients, count to day, 10 of your cycle. So cycle day 1 is the first day of full flow of your period. Count 10 days from that and have intercourse every other day from day 10 to 16, let's say. And if your cycle is perfectly normal, you should be getting the timing right. Now, let's say you've been doing that for, as you said in this couple's case, 14 months, and you talk to your OBGYN about it. A good OBGYN would start doing some kind of a workup. So easy things you can do off the bat, check the sperm, right? We always forget about the sperm. As women, we always blame ourselves for not getting pregnant. But at the end of the day, the men are like half the the battle here, right? So a semen analysis is something that's very easy to do. It's non-invasive. It's usually covered by insurance. Even if it isn't, it's not expensive. And so just kind of check that box. You can also do a test called they should be talking to you about a test called an HSG, a hysterosalpingogram, which is a radiologic test that looks at the uterus and the tubes. And then we have to evaluate your ovaries. So with ovaries, we worry about two things, right? Egg quantity and egg quality. So egg quantity, we call that ovarian reserve. You may hear that term sometimes. And that's just how many eggs do you have left? Because women are born with a certain subset of eggs. So the more eggs you have, the more AMH you make. We know from testing hundreds of thousands of embryos at different age groups through IVF that at 30, around half your eggs are genetically abnormal. By 35, it's about 55 to 60%, and by 40, it's about 90%. And that's where the timelines come into play. That if you're over 35 and you've been trying for, even less than a year, maybe you should start to think about seeing somebody.
Dr. Davison, are those the set of tests you normally order when you see a patient in that scenario?
That's pretty much it. Yeah. Assuming that there's no problem with the cycle length, then, right, you're checking mostly the structural things and then the quantity of eggs. And then we get into a different set of tests when you're assessing for the actual presence of ovulation.